Hi, my name is Dr. Shireen Higazi, and as a chiropractic physician, I've been helping people deal with pain for over 20 years. Currently, I've been working together with a medical doctor to provide regenerative medicine cellular treatment. Regenerative medicine is commonly called stem cell therapy, but it is much more than that. Regenerative medicine uses different cells for the creation of new tissues, reducing inflammation and correcting the causes of pain. In this video, all the treatments available are referred to under the single term stem cells, but what we use in our office are human cellular tissue products. So please watch this video, take notes in case you have any questions for me, and listen to how we might be able to help you with this breakthrough new treatment. So the first thing we should talk about is what is normal. So normal for a joint, and there's actually something called the Kellgren-Lawrence scale, which we'll go over, but the Kellgren-Lawrence scale defines a joint from absolutely healthy to a little bit of damage, to more damage with arthritis, to totally bone on bone. And it would really depend upon which of those phases your joint is in as to what the most appropriate treatment would be. We typically, on this end of the scale, when a joint is very healthy, would resort to physical therapy or rehab. Just as standard therapy typically does the job. Now, most of our patients have some form of varying degeneration in their joints, and that's why they're here, because the therapy hasn't worked. When that happens, most people then try cortisone shots. So the problem is, cortisone itself causes more arthritis, and as most people have found out after multiple rounds of cortisone, they actually still have the problem, or the pain has actually gotten worse and they're not able to move as well as they could before. Because even if cortisone does its job in relieving some discomfort, what it doesn't do is protect the existing damage in the joint. So as a result, every step you take causes more pounding in the joint, and as the cortisone wears off, you actually now physically have more damage to the joint. In addition, one of the known side effects for cortisone is that it actually pits or damages the general cartilage in your knee, causing it to degenerate further. It causes the ligaments to thin and shred, causing them to become weaker, causing more arthritis. And most people are completely unaware that every injection of cortisone causes a bit of bone loss, which eventually will lead to osteoporosis. And if a person has enough cortisone, it'll actually cause the bone to melt like candle wax and will actually cause the bone to die, which is something called avascular necrosis. So although cortisone has its place, it's very short term and very limited, and it by no means fixes the underlying problem.